Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Okay, about 6 months ago, I was planning my walking trip in Europe, and the backs of my legs were really tight, and I had trouble even walking around the block without tight muscles. So I talked to a fellow expat named Peter Graves. Some of you may know him, a Brit, but I still liked him. And, oh, good. I got a laugh at probably another Brit. Anyway, he told me about an acupuncturist named Bibi. And so I went to Bibi, and you're right, I walked out feeling a whole lot better after just one session of her putting needles in the back of my legs. So I've asked her to come and talk to you today, so I'm very happy to introduce to you Dr. Bibi. 28 years old. I mean, come on. How can you be 28 and so successful? But she is.
Thank you. Hello, everyone. Thank you for being here today. My name is Sutratinee, a TCM Doctor Chinese Medicine. I completed my traditional Chinese medicine in Thailand and China, including I study at Chiang University in Bangkok and Liaoning University in China, a total 6 years of professional training. Okay, today I would like to talk about many of aspects as experience, but often overlooked, living with pain, stress, and poor sleep. Okay, let's start a simple question. How many of you have experienced neck pain, back pain, stress, or poor sleep? Okay, many people think this is a separate problem, but actually they are deeply connected. This is a cycle I see every day in clinic. Pain increase stress. Stress affects pain increase stress. Stress affects sleep, and poor sleep then make pain worse. Okay, this is a chronic pain, right? Chronic pain is not just about muscle. This is it's also involved you have the nervous system processes pain. Over time, your body become more sensitive. This is a common case. I see every day my patient come in with office syndrome or neck pain that radiates into the head. They think this is from they think this is migraine. This actually from muscle tension. How acupuncture help pain? Okay, usually acupuncture help relax muscle, improve circulation. It can help blood flow. Stimulation, natural approved is a painkiller in your body. It's called endorphin. Okay, stress. Stress is not just your mind. It's up to your body, make you tight shoulder, neck pain, headache, even then make digestive worse or make digestive problem. Okay, nervous system. When you stress, your body stay fight or flight mode. Acupuncture can help switch your body into rest or digest problem. Okay, where your healing can happen. Okay, sleep problem. How many patients tell me they are tired but cannot sleep well? This is often due to stress and imbalance in your body. How acupuncture can sleep? Usually, acupuncture help calm your mind, your body is can do regulate sleep hormone and overall improve sleep quality. Why people should acupuncture? Acupuncture can help natural approach, fewer side effects, work alongside modern medicine, and the last one focus on the whole body. Okay, this is a breaking to cycle. Okay, acupuncture can help reset your system, the breaking the cycle of pain, stress, and poor sleep. How to express? I think how many people worry about that. Acupuncture is painful, right? But usually acupuncture is just a little bit tiny. This needle, when I put needle, it feel pain a little bit. It's normal, but just more painful or just needle is feel like pain a little bit. It's normal. Okay, you don't worry about that. Okay, example. Okay, for example, my patient come with neck pain and insomnia. After a few sessions, its both symptom is improved. It's much better. Okay, you don't have to live with pain as your normal. When pain improves, people think not just better physically. They think they start enjoy life again. Thank you.
Okay, I'll let you know about Akura Acupuncture Clinic. Our clinic is on Jomtien, Pattaya Road, and we provide professional acupuncture and holistic treatments in a comfortable and relaxing environment. If you would like to make an appointment or require our services, please contact us on phone number, online, or WhatsApp. Thank you for your interest. Any questions?
Yes, thank you very much indeed for your presentation. I've always had a fear of needles. Ever since I was young, my mother would insist on sewing buttons onto my shirts while I was still wearing them. And she used to pull it past my face. And for that reason, I ended up with a fear of needles. But having said that, I found something which works for me. I don't know whether you've had any experience of it, but let me show you. No, it's okay. It produces a pinpoint electric shock into the area that you want. Have you had any experience of this yourself? Because I found it works for me.
I see before, but I never try. My clinic is have electric, but it's look like electric. You are electric, but it's not same.
It's not the same, but I use it on acupressure points the same. I mean, for instance, getting rid of a headache, you press it on here and press the button and keep it for 30 seconds and your headache's gone. I find it works for me for different parts of the hand, for different parts of the body. But you've never experienced it yourself?
Yes.
If you want to try it yourself afterwards?
No, thank you.
He's always trying to get women to try things out he's holding most of the time. Now, just another quick... these sorts of things really interesting. And I'm actually going to get her to ask about another thing, which is the cupping. Because it's not just acupuncture you also do cupping. Anybody else here familiar with cupping? Right? I found that very, very powerful too. Would you like to say a little bit about the cupping and how it helps?
Right. Cupping therapy is not same acupuncture, but example, if you have just muscle tight, it's not deep muscle, can do cupping first, but just skin. But if you feel pain or example, pain, numbness or soreness, I think the acupuncture is better more than cupping.
And the other thing in terms of self-diagnosis, don't get me wrong, I sometimes, somebody says they've got a headache, I'll press, in that point for them. But the thing is to get a diagnosis, because the whole meridian complex in acupuncture meridians and stuff is specialist knowledge, etc.
Hi, thanks for your presentation. Just going back to your second or third last slide, you showed the needles with electric wires on them. Can you explain that, please?
Everyone is not have different, right? Some people, if have muscle tight or numbness, soreness, just acupuncture cannot fix. It's deep. It can have electric. It feel like tick can relax muscle. It can help together.
Well, I think Ren kind of asked my question, but you said you had other modalities beside the acupuncture, and I just want you to let us know what those were.
Okay. In my clinic, it have acupuncture, can help therapy, right? It's mostly example if you have pain relief, soreness, numbness, or paralysis, or stroke like this. And we have acupuncture for Thailand. It's lose weight, can help lose weight. And number 3 is for beauty. If you have the wrinkle or you want to do face lifting, acupuncture can help. But it's not same if you do injection Botox. It's just not lift one session, but do many sessions. It can help because this needle is natural treatment. Okay, and cupping, I explained before, right? And gua sha facial can help too if you do acupuncture beauty, do combination is better. And some people do acupuncture is just same or it's not work. I have another choice, Chinese herb. I give the Chinese herb, you take it. Because I cannot tell everyone acupuncture can help another symptom or can help everything, but have another choice. If you want to try Chinese herb, but first I check your power or diagnosis before I give medicine.
Yeah, I got very good benefit from Chinese herbs from Anthony Wellhung Hoi in Australia, but mind you, some of them tasted like bat's bath. It's really, yeah. Curtis is nodding his head, but yeah, they are very powerful.
Okay, thank you for your information. I would like to see the picture of the QR code, please. Thank you.
Yeah, thanks for your presentation. Twice I've been to Bangkok Paddy Hospital, and once after COVID because I got very bad tinnitus. And they used a program called dry needling, and also I had a trapped nerve down my arm, and they did the same thing. Can you explain? Is that the same as what you're doing, or are they? Because hospitals didn't used to do this sort of thing, but now they must be doing something quite similar to what you're doing.
So if your muscle really tight here, we also do the dry needling first. But our clinic is special, like we have to stay needles around 30 minutes for like muscle relaxing. So dry needling can help, but just for not stay the needles. Yes, something like that. If we stay, we can have time more to muscle relaxing.
What's the difference between the dry needling and an acupuncture needle, I think is the question.
I can do that.
I think it's about the time when dry needling, just a little bit for let the muscle a little bit, like when we tie around here, muscle contraction, so we use the needles for relaxing muscle. If dry needling, we put like just a little bit, but our clinic have to stay the needles and put electric more for more relaxing, something like that.
Gua Sha is a powerful technique of removing muscle adhesions in the body. I was trained in this by a physical therapist in the United States. Basically what happens is when we overstress muscles, we will rip them apart. And when the body glues them back together again, unfortunately, it may glue it to the next muscle fiber and the next muscle fiber, and end up with a big muscle knot in your muscles. And you need to break up that adhesion happening between the muscles. So the Gua Sha technique, that's what it's known in Asia. There's a more simpler term called muscle scraping. And basically, you take a tool like this, and you scrape the muscle quite vigorously, and it breaks those adhesions. This works quite well. And then the other point is for your acupuncture points. These are great things to have and keep with you. And
so I think in China, what you describe with the muscles is usually known as coining, or in the West it's often known as spooning. And you can just do it yourself with a spoon and some moisturizer or something. You want to try it if you've got a stiff muscle. I use it if I do have a stiff muscle.
Thank you. I just wanted to know actually how many sessions would I need to go to relieve my neck pain?
I cannot assure you how many sessions because everybody respond about needles not the same. Some people just 1 time, 2 times they can get better, like 10% or 20%. But some people respond like slow little bit. They have to repeat again, something like that. But I recommend for 6 times. For it's better, it's good.
You have to go at least once, okay?
In the UK, you cannot get acupuncture treatment on the NHS or any of their hospitals. In Thailand, you have acupuncture clinics in a lot of the hospitals. It seems to be far more acceptable here than it is in other parts of the world, mainly because of the Chinese influence of acupuncture and Chinese medicine. How do you feel about the hospitals doing this acupuncture?
Actually, I don't know. We study 6 years for traditional Chinese medicine. I don't know about hospital, how they learn, and I don't know.
How qualified they are, so there you go. Good answer.
Thank you for coming, Dr. Vivi. I just wondered, a typical session, if you go in and you find where the pain is and put the needles, how long would you be there? How long do you leave those?
20 minutes. Okay, just 30 minutes. Yeah.
Sorry, can acupuncture help a major nerve problem like a nerve disease, or is it strictly for muscles?
Okay, acupuncture can help if you have nerve damage, muscle, tendon, but cannot do for if you have structure. Or example, your bone is have problem, cannot. But if you have nerve, muscle, tendon, or ligament, something like that, can help.
ขอบคุณค่ะ
Thank you.
Okay. Thank you, doctor. Thank you for this session. Question. So, do you consider acupuncture as an alternative to normal medicine? So, do you recommend that we try normal medicine to solve the problem and go to acupuncture as an alternative, or to do it in parallel?
I think can do combination, but it's some symptom cannot. Example, if you have problem about cancer, I think cannot do acupuncture.
I just want to add one last thing. This, her staff is over here, and where's the other girl? Anyway, and here. The place is extremely clean. The ladies are extremely helpful. She has one nurse for every section that you go through, plus BB herself. And so you get very well treated. And she's very good at prognosis, of telling you how many sessions you might need, or if you choose to just go longer because it makes you feel good. So I highly recommend BB and her office.
Well said.
Thank you.
I think we're all done. And I highly recommend acupuncture, and think of it as, definitely something you want to think about supplementing your medical range of complaints, etc., etc. As I said, I pretty much always walked out better, feeling better from an acupuncture treatment than I felt walking in. So that's something to really think about. So thank you. Thank you so much. We have a small token of our appreciation. I'll come over here a little. Thank you. Well said. Now, so there will be a notification, of course, and it'll be in the newsletter, but there is going to be discount for members of the PCEC. So you save money by just, paying your annual yearly fee of only $500.